And we're back with Stacie Barber for the first time on the podcast. Stacie, I'm sure most people listening know of you or know of your Instagram handle and your company, but for people that aren't familiar, can you tell us who you are and what you do?
Yeah, of course. So my name is Stacie Barber. I am a doctor of physical therapy. I'm also a strength conditioning coach, mobility specialist. I was a collegiate gymnast, and I'm the owner of the PhysioFix. So the PhysioFix is here in Phoenix, Arizona. We kind of blend rehab and sports performance, kind of hit the whole spectrum. And we have an actual the brick and mortar facility here, but we also treat online. So we do a little bit of in person, a little bit online, and we're all cash based at this point.
And I see on y'all's Instagram that you're expanding the brick and mortar location.
Literally, like right now, like they're breaking down the walls like as we speak right now. That so it's very exciting. We're doubling in size from like 3,000 square feet to 6,000 square feet.
That's awesome. Congrats.
Thank you.
Today's conversation is going to be unique and very personal to you and your family. And for anyone that's followed you over the past few months or years, is probably familiar of what we're going to be chatting about. But can you tell us what happened to your husband and Logan? And then I want to dive into this whole journey and process so far.
Yeah, yes, it's quite a lot. So he had a stroke September 9th, so about 7 months ago, 7 months and 3 days ago. I was actually in Australia. I was speaking at ValdCon. So ValdCon is like a big conference that they have every year. They invited me out as a special guest. So I was in a different country. I was literally at the other side of the world when all this happened. I had been there for less than a day. So I flew all the way there. I was there for less than a day. And then I get a call from his mom early in the morning. It was early in the morning their time, late at night for me. And she was like, Logan is acting funny. He's unresponsive. He's laying on the ground. What's going on? And I was like, well, look in the area. Do you see anything out of the ordinary to explain this behavior? Because that's the first thing you don't think of a 37-year-old that's healthy to have a stroke. So she couldn't find anything. And so I was like, let me see him. And I like noticed a little bit of facial drooping. And I said, I think that he's having a stroke. Call 911. And I think it was 4 a.m. So 4 a.m. in the morning. And my daughter, who was 10 months old at that time, that's the reason why my mother-in-law was in town to watch my daughter. And since my mother-in-law was going to have to be going to the hospital with my husband, obviously her son, I was like, I have to figure out what to do with my daughter at that point. And so I called my best friend who happens to be our office manager because she's that person, the ride or die that I knew that would answer the phone at any time of the day for me. And so at 4 a.m., she answered the phone and I was like, can you go watch my daughter? I think Logan's having a stroke. And she was like, I'll be right there. So she went and like helped out with Oakley as they took Logan to the hospital. They came to find out that he had not only pneumonia, they brought him in and he already had pneumonia, and he had been having this like nasty cough for quite a while. But with us having a newborn child and her bringing home so many different germs from daycare, we both were kind of very sick last year. And we had like a little bit of cough and a little bit of cold here and there like the whole time. But he had this like cough, and we can't come to find out that's walking pneumonia that he already had and he had been dealing with. And he also had a massive brain bleed. So he had a hemorrhagic stroke and it covered his MCA. It went down to both lateral ventricles. It went into his basal ganglia. It went to his cerebellum, his thalamus, and I think they said a part of his pons was also affected. So a massive stroke. When I finally spoke to the doctor, once again, this is like now midnight my time when all this is kind of happening, and he said, I don't think he's going to survive. And I said, I will be right there. And I was like, but right there means 24 hours at least for a plane ride, you know? And I was like, please do everything in your power to keep him alive. And the doctor, obviously, he's like, I'll try my best. I just have no idea until I get in there about what we're going to have to do. So they did a craniotomy on him and he did survive, but we had tons of complications after that happened. So he actually ended up having, from the pneumonia, it had turned into acute respiratory distress syndrome at a certain point. He was having trouble breathing. That turned into lung failure. I was obviously there when all this kind of was happening too, because his brain was getting better. That side of things was actually doing really, really well. And then his lungs started doing worse. And we were like, they were thinking that he wasn't going to survive again from that. And it was like in the middle of the night at this one specific hospital. I'll never forget this. They didn't have doctors on staff at night, and they only had nurses. And that was bizarre to me that they had to do a teledoc appointment. So they had to call somebody who was just a camera in the sky, like a person, and he was the one making the calls for my husband at 3 a.m. in the morning when he desatted and he was like essentially on his way to dying. And they were trying to bring him back. And excuse me. So they decided right then and there that his form of like acute respiratory distress syndrome was very similar to what people experienced during the pandemic, with their lungs were doing not so well and they're having a lot of respiratory problems. And they said that what they did during that time is they did a paralytic agent on these people and they did a lot of proning. And so they decided that that's what they were going to do to my husband. And so they said it's very scary because so many tubes, so many wires, so many things like coming out of my husband. And they had to, obviously flip him on his stomach, and then have him lay there for 18 hours, which helped like with oxygen perfusion to the lungs. And then they'd have to flip him back to his back and then let him sit there for 6 hours and then like rinse and repeat. So like they did this for probably like 7 to 10 days, which is crazy. You hold your breath every time that they do these things. And then during all this time, nobody did any physical therapy on him besides me. So I was like moving his limbs and stuff like that because I just knew that like early mobilization is key. Even before he was on the paralytic agent, I was like doing those things. They had a hospital policy that they didn't touch anybody that was on a vent. And I thought that was absurd to not mobilize these patients because it had already been a month by this point when we got on the paralytic agent. And then after all of that is said and done, he got a pulmonary embolism. So our third ringer was the PE, and it wasn't from his limbs because I'd been moving the limbs and stuff, so it was literally just in his lungs that the PE happened, and he survived that as well. He actually just got off blood thinners on Wednesday, so he'd been on blood thinners for a good 6 months, which is very normal for like PE. But yeah, we had quite a process, and then I got this one doctor that came in the room one day and said, "Your husband really is gonna die, and he has multi-system organ failure, and I think that it's probably just best to let him go." That's what the doctor said to me, and I was like, because I was his medical power of attorney, and I said, "There's no way." I was like, "My husband is like the strongest person that you would ever meet, and we are gonna fight for him because he would fight for us too." And I tried my hardest to get him transferred to a different hospital because I just felt like if a doctor is already saying that, they're not going to provide as good of a quality of care as like I want them to provide. Like they've already given up hope on my husband. And so I like fought like hell, and I even went to Instagram. So this is like the first time that I like asked my community, of like 900,000 followers, if they knew anybody that could help me get him transferred. And lo and behold, they did it. Like, so my community kind of rallied in my corner, and they were like calling the hospital, is like asking everybody that they knew. And somehow, some way, we got him transferred that day. So like that day that everything was kind of transpiring. And from that point on, Chris, everything changed. Like we got to the other hospital. Within 2 days, they took him off all medication. Then the next day, they took him off the vent. The other hospital said, "Oh, he's going to have to be trached. Like, we're going to have to put a peg tube in him because it's been too long at this point." And I was like, "You guys haven't even tried, like none of this stuff should be happening." I felt like they were overly sedating him and there was like all these problems. So, anyways, he got off all the stuff, and then like within the next like week or so, we got admitted into inpatient rehab, and we were there for about 2.5 weeks. Got home a couple of days before our daughter's first birthday, which was really special to be able to come home like right around that point. And since then, Logan's been kicking ass. He's been like, he's had good days and bad days, but he's been crushing it. Like, I don't know if you saw, but he's able to like back squat 155 pounds now. He's deadlifting like a trap bar deadlift, 225. Like, we are doing really well. He's a power lifter. So he used to be a really, really, really competitive power lifter. And so those things are meaningful to him and those make him feel like himself. And so, yeah, I'm helping him do some of that sort of stuff. And then he has a whole rehab team that's been doing speech therapy, occupational therapy, physical therapy, and vision therapy because he lost his vision at one point. So I'm sure you have questions, but yeah, that's a quick recap of the last 7 months.
Yeah, that's the crazy how much has happened and amazing how much progress he's been able to make. And yeah, I have quite a few questions. How long were you all or was Logan in that first hospital before he was able to get transferred?
A month.
A month. Okay. And then when knowing that they weren't willing or open to provide physical therapy and you started that process on your own, obviously, PhysioFix and your setting is outpatient ortho, and I'm assuming you haven't been in the neuro or acute setting since probably you're in rotations.
Mhm.
How was that initial process for you of moving your husband's limbs and just like how did you manage that and deal with that?
Yeah, I thought that all the nurses looked at me like I was crazy when I was like moving his legs and arms around the whole time. They would come in and like check in on him and stuff like that. But I was like, if you guys aren't going to do it, I'm going to have to take matters into my own hands. And I'm completely willing to do that. I'm not a neurotherapist, I'm an ortho and sports therapist. And I was like, but we all learn neuro, neuro, like at least like from a basic level, we know that early mobilization is key. We know that there's the PNF patterns that like, we all learn in school. So I was like, I'm going to learn or do everything that I was taught in school on that basic level. And then people were giving me like feedback too, like neurotherapists were like sliding into my DMs on Instagram and like, hey, do this. And I was like, thank you so much. Like I was all about getting welcoming all the information coming my way, but it was a bit weird, to get into that. But like I would stretch him out like like a normal session for me. Like sometimes with patients that are really stiff, like so I'd stretch his limbs. Logan's pretty stiff by nature, anyways, being a really competitive power lifter. So this was like the first time that I was like, oh, I actually get to like stretch about without him just being like, ow, because he was in an induced coma for so long. So I did that. And then as soon as he started coming to, I would try to like walk him through PNF stuff. So I'd be like, pull, 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 push, 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 like as I'm like doing different things. I brought in my STEM unit. So like did NMES on him, try to just facilitate as much as I could, getting those fibers and that recruitment. Obviously, it was still, he had very much a flaccid limb on that left side, both the arm and the leg. But I was reading the research, I was going down all the rabbit holes, doing everything that anyone would for the most important person in their life. Like what can I do? I would stay up like all hours of the night researching, trying to like figure out like what can I do to make his recovery better, make his life better. Soft tissue massage. I would bring in my daughter's toys, and she has a lot of these like fine motor skills that she's learning, right? So I would just bring in like the things that she has at the house. And I was like, hey, he could probably benefit from this too, because he's having to relearn the gross motor, the fine motor skills as well. So same sort of thing. I would just like use what was available to me and like pull from my resources and just try to throw everything at it, the whole kitchen sink, and see what was most effective. And I don't know, but everyone says that he's progressing faster than anyone that they've ever seen in a similar circumstance. I mean, obviously, similar circumstances, most people didn't survive something this drastic, but um, he's well exceeding everyone's expectations. And I don't know if it's from like what I did or just who he is as a person, but I do think it's like a combination of everything. And just like, we always say, like, what is going to happen if we just give it our all? And so we're giving it our all. We're treating his recovery like our full-time job. And like it's not just 1 hour a day of PT, or 2 hours a day of PT and OT. We're doing things around the clock to make sure we're maximizing his level of function.
What's scary is how maybe drastic or varied outcomes can be based on the healthcare system or hospital that people are admitted to. And if they don't have the resources of potentially transferring, or they don't have the
Mhm.
health literacy or the knowing what questions to ask, or pushing and being advocates for their spouse or their partners or family members to seek the best care possible or have options. So y'all were in an amazing position to have that transfer of care, which sounded like a great option. And y'all were there at that next hospital for, you said, a week or two, and then inpatient rehab for about 2.5 weeks.
Yeah, yeah. So we ended up being in the hospital and the rehab stuff. We were gone for 7 weeks from our house. So I think it was about roughly a month at the first hospital, and then it was like roughly like maybe 10 days at the second hospital in like the ICU or the drop down unit before we got admitted into the inpatient rehab. And that was a whole other thing because I don't know if you want to go into this, but our like if I didn't have health literacy and like I wasn't an advocate for my husband, he would have been in a skilled nursing facility because the case manager came in to the room and said, she goes, "Hey, we'll submit for inpatient rehab, but I just want to let you know it's going to be denied. And these things always get denied. So why don't we just save all of us problems and time and just pick a skilled nursing facility for your husband?" And she handed me a list. And I told this lady, she was standing in the doorway. She like wouldn't even like come into the room. And I was like, "Ma'am, can you just take a second to look at my husband?" And she like looked at him and I was like, "Do you know how old he is?" And she was like, "No." And I was like, "Well, that's first off, that's the wrong thing to answer because you're the case manager for him. You don't know how old he is." And I was like, "He's 37 years old. There is no way I'm sending him to a skilled nursing facility." And she was just like, "Well, I'm just going to tell you that it's going to be denied." And I'm like, "Well, if you do your job correctly," I was pissed. I was like, "If you do your job well and you send the right paperwork, it should not be denied. And we can do a peer-to-peer review." And I was like, she was like, "Oh, you must be in healthcare." And I was like, "Yeah, I am in healthcare. I run my own practice. I deal with insurance on a daily basis." So I was like, "Whatever we need to do, let me know if you need my help." Like, I will help you do your job, sort of thing. I was kind of getting into my type A self, but I was pissed because like, and then it got denied twice, Chris. It got denied twice because she submitted the wrong paperwork. And I like went to ask her questions and she was like, "You're not allowed back here." And then she'd be dodging me in the hallway. And I was like, "I'm just trying to get the best care for my husband. You would probably do the same for your loved one." So I was like, "I know that you probably have like compassion fatigue at the end of the day because us as healthcare workers, I get it, but you should treat everybody with the same amount of respect and decency as anybody that you truly love, and do whatever you want or need to do for them." So anyways, I had to pull resources for that as well to get him transferred. And then to like, I was like calling the insurance company myself saying, "Okay, how can I set up the peer-to-peer review?" Like things that I shouldn't have to do and things that other people don't even know to do.
Yeah, well, props to you, but also, yeah, what a slap in the face for people that aren't familiar. The difference in just perception and care and what the trajectory looks like, and someone going from acute hospital to either skilled nursing facility or inpatient rehab is a very different course of care and kind of
Yes.
prognosis and what that means. And skilled nursing facility, generally people aren't going to be rehabbing back to potentially living at home or to their prior level of function or all these things. They're not getting the volume of care and treatment that they would be getting in inpatient rehab. Can you touch on that 2.5 weeks that y'all were in inpatient rehab? What does that look like for people that aren't familiar? And then once he was fully discharged to go back home, how was that transition back to the house?
Yeah. The inpatient rehab, how phenomenal. Like I had not had any exposure to inpatient rehab before. On my clinical rotations, I did an acute care setting, kind of floated different floors. So I didn't know much about this. And now like seeing what they do, I'm like, that would have been such a cool experience to have myself. But it was intense. Like when they say like you have to be ready for intense therapy, you have to have the capability to do 3 hours of therapy a day, and that's like spread over the disciplines. So if you need more physical therapy, then you're going to be maybe doing 2 hours of physical therapy and like 1 hour of occupational therapy. Logan needed all the disciplines because he actually didn't get released to eat food. He still had an NG tube because I still kept refusing a peg tube all the way until the 3 days before we went home. So for 6.5 weeks, he had an NG tube. So he had to do speech therapy, which was like swallow therapy. So they did like biofeedback. They put these electrodes on his neck, and then he would watch himself to see how forceful of a swallow that he could do. And so that was really cool to be able to see how everything was functioning and to see where he needed to be because like every single time would get better, but still like you and I would be able to produce like tenfold of what he was able to do at that point. And it's just because that weakness that he had, even in a swallowing capacity. So we had an hour of speech therapy every day doing that. And then he had an hour of occupational therapy every day to try to get any sort of movement back in his arm. He didn't have any movement. Like I said, he was still flaccid until we left even the neuro rehab facility. He didn't have, a lot of people have tone and spasticity that kind of sets in. His like recovery was like delayed. Maybe it's because he was on the paralytic agent. I'm not really sure. I don't know the phenomenon and like the whole pathophysiology of any of that stuff, but I just know that everything that I expected to have happen did not happen. So he just was unable to move his arm. And so they would just use more electrodes. They would try to like, they did a lot of things with electrodes. He was always had pads on him in occupational therapy. He would do like a bike. They would try to like get his hand to like grip something with the electrodes and the timing of that. And then like the co-contraction and all that stuff. And then trying to just get his any sort of proximal involvement because he had a subluxation in that shoulder just from the disuse atrophy and just muscle atrophy in general. So he had like a two finger separation. So they wanted to try to improve that. So they would have him his arm like a skateboard type thing, and then like like bending and straightening his elbow and trying to just break out of some of these synergies too. Um, it was really cool, but they did a lot of things to try to focus on just getting any sort of movement in his hand. He could we would do things on the side too that would be able to like get him to like do like rowing and stuff like that, but he didn't have anything at his hand at all once we even left OT in the rehab facility. We did an hour of PT every day. They did a lot of gait training. So a lot of in that setting, gait training is like the king. And so they did a lot of like sit to stands and then like walking. So walking with the exoskeleton. He hated that. He hated the exoskeleton because it makes you move a certain way. And he said that it was just very much non-fluid and didn't feel normal to him. And so he didn't like that one at all. Then they had some other ones that were like it was another like bionic device that to help him walk too. He liked that one a little bit better than the exoskeleton, but he just really liked more so the harnesses and then like on like the system, the track system. And so he had the ability to walk on his own, and then it would catch him if he needed that assistance before he fell. So they did a lot of that, and then also assisting with like transfers, transferring to get in and out of his wheelchair, because obviously he was going to have to go home with a wheelchair. And then he had recreational therapy in that setting too. And recreational therapy is just to get back to your hobbies and things that you like to do. So he likes to draw. He also is like a welder. He does construction and fabrication. And so it was just to like kind of wake up those creative juices. And they would do like sometimes they would do play poker together, like as like everybody in the rehab facility, which was cool to like hear their stories and just like build a community within like, everyone's going through their own thing, but we all have similarities and let's talk about it. So they would like just sit there, kind of like talk about things as they were like doing their chosen activity, whatever that was. And then he also had neuropsych. So neuropsych is obviously there's a big component of this that's just mental, right? They're like you're not who you used to be, and it's a drastic change in a very short period of time. So how are we handling that? And so just like talking through things and like figuring out how we can have resources and like how to best like even for us as caregivers of like how we can like make sure that we are talking to our loved ones in a way that are like is reassuring to them and not like it's not going to be like negative at all or perceived, and it's really hard. It's hard to navigate. It was so hard for me to learn how to navigate. So I would like after they would leave the room with Logan, I would go and be like, "Hey, I have a question." And then like I just wanted to make sure that I was being like respectful, and I was like, like I noticed this. How do I've never been in these shoes before, like I don't even know how to navigate this situation. And so they would give me counseling as well, which was really helpful.
Can you elaborate more on that part of what were some strategies or what was some of that counseling of ways to either communicate or cope or discuss things with Logan? Yeah, what did they teach you?
I mean, they taught me pretty much like things that like I kind of knew, but I just didn't know if I was doing it right, sort of thing. So he had part of his brain that was affected by his stroke was is like the mail was going in and being like it was being sorted to the wrong places. So like information would come in, but it wouldn't be able to go out, if that makes sense. So he lacked this awareness of what was going on with his problem and his limitations. And so for me, I had to figure out how like, okay, I don't want to be just say over and over, like, you're not able to do this yet. Like we have to make sure we do it slower and stuff like that. So I would ask them for like ways that like I could reiterate like where he's currently at so he could see it so he doesn't hurt himself. And those are like the simple things that like, they'd be like, okay, well, have him write down in a diary or like, when the night before when he's like really understanding what's going on, have him write it down. And or if he doesn't feel like writing down, because he didn't want to write for a long time, so I'd have to write it down for him, and then he would have to sign it to show that like, okay, and then I'd have to show it to him the next day, like, hey, this is like what you said last night, and then like this is what we're going to build upon today, and stuff like that. So it was just like strategies to cope with like what was going on, and to reiterate every single day, because he had this like the short-term memory loss. He had long-term memory was fine, but short-term memory was really affected at first.
Y'all are in inpatient rehab 2.5 weeks. What did it look like with Logan coming back home over this first few days or weeks?
That was rough. Like I didn't even really think. Everyone kept saying like take time for yourself, like make sure that that you're getting away, because as soon as he comes home, it's you're going to be the one that's responsible for him. And I was like, I'm already responsible for him. Like, and even in like the rehab center, like I never slept at home, Chris. I like stayed every single day for 7 weeks. I stayed with him by his side in the hospital, in the rehab facility. Like they got us a private room so then I could stay there with him and like do like other rehab on the side to help him out. But I didn't realize that I really should have taken even that advice that people were giving me, because as soon as we got home, it was all on me. And Logan didn't want to have anyone come to help out at first when we got home, because he didn't think that he needed help, and there was still that like that disconnect between like what he could actually do. And so when we first got home, my mom actually was still here and my grandma was still here for a couple of days, but like we were going to try to just do everything by ourselves and kind of see how it went at first, and see then how much help we truly needed, and then figure out like a system for how we needed to manage schedules, because we don't have any family out here. So my mom is in Virginia and my grandma's in California and his whole family's in North Carolina. And so everybody that came out here to help us out was going to have to fly in. So we were trying to like figure out a schedule for like how much help do we need and when would it be best for people to come in, and for therapy and driving and all that stuff. So it was just a lot of trying to like figure things out at first. We had to get grab bars, in the bathrooms, and we had to get grab bars in the showers, had to take the doors off of all the hinges because he had to have enough room to be able to wheelchair through. Like if you don't have like most of our doors, like this isn't wide enough for him to go through, and it's like we had to take all these things off, and you didn't even realize that we had to take every rug and carpet off the ground. We had just tile floor. So all these things that you don't even like consider, how to rearrange furniture to make sure that it was just best for navigation. Obviously, shower chairs, transfer chairs, like stuff like that. And just being able to like learn how to navigate life now with a wheelchair in the house. Even the dogs, like when we first got home, like the dogs were like, what are you doing? Like as you're like, wheeling around, because they just had never seen that before. And they were like barking, and then like our daughter would get upset, and because the dogs were barking, and then we had to be careful of like navigating around our daughter, and it was a lot. So I would say that like that first maybe week or two, it was just like a honestly like a learning curve, like trial and error, try to like try different things and kind of see what's best for us and see what's best for our family, and then start to ask for help.
Yeah, when you started asking for help, what did that look like after those first few weeks?
Yeah, so I remember sending a message to Logan's whole family, and I was like, "Hey, it's been a couple weeks that we've been home. Like, I think that we realized that we do need more help than we have kind of told you guys we need so far, and it would be cool if you guys can, I don't know, make a schedule of when you wanted to come out here to help, because Logan has one sister and two brothers, so he has plenty of family, and then his a mom and his stepdad, and so they would just be like, okay, I can come out this week, and the next one would be like, okay, I can come out this week. So we'd have like 1 week at a time with each family member, and then my mom would get thrown in the mix and my grandma would get thrown in the mix, and like so there was sometimes maybe like 3 or 4 weeks that we'd go without somebody here. And I could tell you that I was so drained by the end of that 3 or 4 weeks that I was almost like, I need somebody here. So I started to realize that like I can go 2 weeks by myself at first. And then that third week, it was going to be like really, really hard on me. Like, I wasn't able to get my work done at work, or be able to be a clinician. And because I was trying to like, be a little bit of myself too, and like be a clinician and help my patients and still help my husband at home and still help my daughter, because she was just starting to walk. It's like making sure that everything is now also baby proofed for her and that stage of life. So it's kind of like it was a really hard stage because there's so much changing all the time.
Yeah, I that was going to be one of my questions. Were you during this period of the transition back to the house also working and trying to manage either patient care for yourself or business as a whole? How much of that did you take on, and did that fluctuate, and did you pull back, or what did that look like for the first few weeks or months?
Yeah, I actually I started to come into the office. So I had my team at that point was super, super young. And like I had someone that had been out for like 2 years, someone had been out 1 year, and someone that was a brand new grad. So they were looking for me for guidance. And I was able to have that guidance all the way until obviously Logan went into the hospital. So they like lost their leader, and I didn't realize how important that was at that point. I thought I had a strong team, and I thought that they'd be like, self-sufficient, and they were making it seem like they were getting by, but I wanted to come in person to be able to just show up for them too and try to like be there to help guide them. And so I started coming back into the office for like an hour here, 2 hours there when Logan was doing some of his inpatient rehab stuff. So that was probably like in like the middle to end of October. And then I would try to maybe like 10 hours a week kind of like schedule myself patients. I have some patients, and I'm sure that you know these patients that just only want to work with you, which is fine. And so those people, they needed help too. And I wanted to make sure that I was still showing up for them as well because they matter to me as well. You're like, you have so many people that count on you and that rely on you. And I wanted to make sure that I was showing up for them. But then obviously I wasn't showing up for myself because then I was like, trying to be everything to everyone else too, which is a whole other conversation. But I would be trying to juggle a lot of things. And I was probably in the office about 10 hours in November and then maybe like 15 hours in December, and then I ramped up to 20 hours in January and then kind of built back up from there.
During that initial period, the 10 hours, 15 hours, how present could you be? Or were you just constantly thinking about all the other things you have to manage? And were you just drained? Like, did it feel like you could even be present because of just all the other things you had to deal with and focus on?
I've always been really good about kind of just when I step into the office, it's like everything else kind of stops at the door, and so I usually rarely am on my phone, like, and I'm just trying to get, I'm working one-on-one care. So I'm one-on-one with someone for an hour. So really I just get to like have a conversation with people and then just try to like figure out how I can best help them. And so it was almost like a vacation for me in a sense, being able to like stop worrying about my own problems for a little bit and help someone else with theirs, in a way. So I don't think that it wasn't hard for me to be present. It was hard for me to make the drive because it was like the hospital that he was at with the inpatient rehab center. It was like 45 minutes away. So I had to drive 45 minutes. I would like wake up in the morning, get ready, do his morning like routine with him because, I was the one that was like bathing him and doing all that stuff too. And so I'd do all his morning routine, get him dressed, and then I'd go to the office, and then he would be doing his like rehab stuff with his anybody his therapist, and then I would come back and then I have to do his nighttime routine. So it was just like I was go 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 go, and the first time that I would have to sit down to like do me stuff or business stuff, like because there's still back end business stuff that needs to happen, would be like 10 p.m. And so it was like 10 p.m. is like, okay, now I'm going to start working on the business. And I worked on the business till like, 2, 3 a.m. And then I'd go to sleep. And then sometimes he'd wake up in the middle of the night, screaming in pain because he had a lot of nerve pain. And so then we'd have to go get his nurse, and stuff like that. And then like I'd maybe sleep like an hour or two a night and then, get up and do it all again. So it was a lot for a while. But it's just, you kind of just, it's in survival mode at that point. It's like, you just got to get through it.
Yeah, that's so much for your own. I mean, you alluded to it, you just have to get through it, but for your own, mental health and managing that, were you able to have some sense of stability, whether it was just social support with family or friends, or were you seeing your own therapist to kind of navigate these, the situation? How'd you get through this?
The gym is my therapist. It's always been my therapist. So like I would, if when I was in office, I would try to even do like a 20-minute workout, like, and whatever I could do. I like to lift heavy. So I just do work up to max whatever I could do for like a squat a day or whatever. And then I would bring like some bands into his hospital room and I would do like late night workouts. So I'd like attach them to the door and then I would just like do whatever I could just to like feel a little bit like myself, like a little bit of normalcy because that's just stuff that I like to do anyways. And so that's always been my therapy. And obviously I would be talking to friends and stuff, but I was overwhelmed by messages that I was receiving because there's just so many people always checking in. Like, I think that I still have over 3,000 text messages unread on my cell phone right now. Like, just so many messages. And, I do appreciate all the support. I just had no time to be able to respond to everybody. So there was a few people that I would just have as like my personal therapist because they were my best friends.
Okay, so you are back home with Logan, and this first few weeks, is he starting outpatient care as soon as possible, PT, OT, speech within the first few days? And are you the one and your family commuting him and driving him to all these locations?
Yes. Yeah. So I had already, being the therapist that I am, I had already found the best therapist in the area for outpatient neuro rehab, and I had already booked his appointments even while he was in inpatient rehab. So I was like, okay, I want us to book out 3 times a week, PT, OT, and speech. And we'll do that for 3 months. I'll book out 3 months at a time. I like to plan my life a quarter at a time. So I was like, let's book out October, the rest of October, November, December, and then we'll, the next month I'll book out another 3 months and stuff, so on and so forth. So I had already booked out all of that, and obviously the best therapists are not close all the time. So our therapist that we go to, we drive an hour each way to go to therapy. So on top of, luckily, since I did book it out so far in advance, we were able to do back to back. So it's like 9 a.m., 10 a.m., 11 a.m. So PT, OT, and speech. And then we would just go there and it'd be like an hour. So it'd be like at least 5 hours of our day just going to therapy. So I also wanted to be the one to take him to all of his therapies at first too, just to like make sure that I knew what I needed to do at home to be able to help him and, move the needle forward. And so I was kind of the one that was navigating all that stuff for probably a good month or so. And then that's why when people started coming into town to help us, then I would like let them, I'm like, okay, I'm gonna go on Wednesdays, but you can take him on Mondays and Fridays or whatever. Cause I still wanted to get like every single week he was changing and progressing so fast, but I wanted to know like, okay, what's the goal this week? What do we need to focus on this week? And always like getting like updates from his therapist of things that I should be doing at home too, which was really good for me.
Over the past few months, as he's progressed through rehab in the clinic with his therapist, I've seen videos of you also bringing him to the gym or your clinic and working on continuing to progress. And I think it was just yesterday, the day before, which you already mentioned, he was back squatting 155, 135, whatever it was. And it's just amazing seeing that this transition of how much he can do over time. Can you touch on what the priorities were or still are for his PT sessions with his physical therapist, and then what you, in addition to that, are trying to work on with him in the clinic or at the house?
Yeah. Yeah, there's just so much that he needs to work on and that he needed to work on, right? There was like you could just spend 24 hours a day working on something different. And that's what was driving me crazy at first, because when I was doing his rehab, when he was in the hospital before he even went to inpatient rehab, I was like, okay, well, we need to work on, elbow extension and elbow flexion, and we need to get like, your deltoid back and all these things. So I was like, okay, there's just like a laundry list of exercises. So in his therapy sessions, neurotherapists, they work a lot on function, right? And so that's kind of their goal. And so high intensity gait training is a big part of what he does with his physical therapist. So they do a lot of getting on the treadmill with the harness system. So we have that like reinforcement in case we need it, and then work on restoring some of his gait mechanics. So he has ataxia because he has hemiparesis on that left side due to all of this. So just restoring as much mobility and strength and function and to get him to just walk more normal. That's a big part of what they do. And then learning how to navigate different things. So they'll do like hurdles, hurdle training, different sort of like surfaces. So he'll walk sometimes on these like rocks that aren't really rocks. It's just like foam pads that look like rocks that have different texture to them to see like how his ankle will stabilize when they walk over that. They get him sometimes in quadruped to just learn how to like crawl and do like some reciprocal crawling stuff. And they get him on the Balance Tutor, which is this like MediTouch device that all this stuff is super, super fancy and very, very expensive, which is why we go to this specific clinic because not everyone has this. But it's this treadmill system that like you can do perturbations while you're walking. And so you'll be walking forward and then all of a sudden the machine will like jar you to the side. And so you have to react. And so it's a lot of that sort of stuff. And then they'll incorporate cognitive tasks with it. So they'll throw I'm sure you've seen like the colors on the screen, but the colors are written in a different color than the word. And so they'll be like, okay, now I want you to read the word instead of read the color. And so then he'll have to do like while he's walking and getting these perturbations, they'll have all these extra cognitive tasks with him or blaze pods or something that's like going to be improving that cognitive focus as well. And it helps retrain his vision because that was a big missing focus as well. So he does that with PT, and that's kind of been a big focus the whole time. And so what I realized with just that alone is that there's just so much for them to work on that they don't have time to work on strength. And so that was a huge missing piece that I saw from the get-go. I was like, man, that you guys don't do any strength training. You would think that if you have, more proximal stability, that everything would be a little bit easier and like you'd be able to function better and walk better and have a stronger and faster gait. And they're like, there's just so much for us to work on. So this is what we focus heavily on. And luckily, his therapist, Chris, he was like, you can do the rest. And so I was like, I am doing the rest. So I was already filling in the gaps. And so I would create Logan like rehab programs. Logan had hip osteoarthritis even before all of this happened. And so I was like, we need to like restore his hip mobility and strength because his ataxia was even more pronounced because he didn't have as much hip extension on that side just from a structural standpoint. So I was like, I'm going to create him a program. And then it's not always me telling him what to do because I put his exercises in my app. And so then it'll prompt him to what to do without me being like, always like, hey, do this exercise. It like sends him accountability messages like, hey, it's time for you to do your workout. And so it's a way for me to help him without always having to like hover over him and tell him what to do. So that's kind of how I've been filling in the gaps from like a strength and kind of an ortho side of things to restore what he's missing and what they don't have time for from a PT standpoint. Now, OT, different story. They do a lot of gross motor stuff. So first it was a lot of trying to like just get his arm to move again. Like I told you, he was very flaccid at first. He didn't have any movement of that hand or, very little movement of the arm. He had actually had tricep before he had anything else, which is very, very strange for a neuro patient. So he was able to have that. And then they were trying to like kind of figure out ways for him to navigate his home environment. And then they're trying to make it more meaningful to him. So how can we change a diaper? How can we pick up our daughter? How can we like, try to like, get her into the car seat or in the crib, like all those tiny little tasks. So they would try to make it as functional and as personal as they could. But then they would do a lot of, and they're still doing a lot of fine stuff. So trying to like pick up blocks with this grip, with a pincer grip, with a kind of like all these different grip types, like fat grip, and then trying to get him to supinate and pronate because that's really hard for him still, and to be able to like just manipulate different objects so he can restore more of that distal movement. So they're doing a lot of that. At speech therapy is, I had no idea what everything that speech therapists do. And speech therapists are like the missing piece to like, okay, you have, all the arm stuff already accomplished. You have all the leg stuff. If you don't have any true speech problems, what do speech therapists do? And they do all the cognitive stuff. So they like take you through all the cognitive challenges. They'll give you worksheets, like they'll make sure that your memory is where it needs to be. They'll constantly retest you, and then like real life scenarios. So Logan, he's like a manager for like his company. And so he deals with a lot of emails that come in and go out. And like, how do we make sure that we are, getting the information, you're understanding what you need to be understanding, and then formulating your response in a way that makes sense. So they would go through all of these different scenarios with him and they make it real life and applicable. They would have him bring in his cell phone and then how to like reorganize his apps on his phone to be a little bit easier for him to navigate. It was phenomenal. And I know Logan hates speech therapy because he thinks of speech therapy as the people that were in the hospital that were limiting him from being able to eat. So he we always had this like negative connotation every time we went into speech therapy. But I saw it for like, wow, this is the thing. There was like little things that I was noticing that he was having trouble doing, like multiple commands. So if I asked him like three questions in a row, he could only remember the first one at first, right? So he was like only giving me one answer, and I was like, well, I asked three different things, but he like was having trouble getting past that first one. So I would send emails to his speech therapist because I don't want him, bring it up in person too, of just things that I was noticing. And so I would just communicate with her and be like, hey, this is something that I've seen recently. Are you able to work that into his session? So I would be like in the background, kind of like helping her navigate because she's only seeing him for, I think we're only seeing speech therapy twice a week for an hour. And so then I was just being able to help facilitate those sessions and make them a little bit more what he actually needs to work on versus like if they would just he would come in and I didn't send an email, she would be like, hey, what do you want to work on? And he's like, I don't know, and like he didn't really have any like he also didn't have that understanding, like I told you, of like what his problems still were and that what we still needed to work on. He didn't have that awareness piece.
Yeah, all of that just goes to show how one healthcare provider can't do it all. And in these
Mm-mm.
contexts, with a variety of different injuries or conditions or impairments, that there's so much value to having the resources and awareness of the benefit of all these different professionals, and that they
Mm-hmm.
all are great at what they do, but it's not the whole picture. So the rehab side and the PT specifically is focusing on XYZ thing, but then the occupational therapist has to focus on this, and the speech therapist and the neuropsych and the dietitian. And it is super challenging, one, to coordinate all that care as the, patient or family, or the case manager, and to have the time and resources to be able to fit in all of those visits throughout a week. And that in and of itself
Mm-hmm.
is super challenging. And I've noticed that with certain patients in the clinic, even though I'm in the outpatient setting, I have some individuals that are coming in with stroke and TBI and spinal cord injuries, and they're just drained of going to the next appointment. And their whole
Yeah.
week is filled with healthcare visits, and it is so
Mm-hmm.
challenging, but it can be so beneficial and impactful, especially if you have the right providers, which it sounds like you all do. That was my
Mm-hmm.
first kind of reflection and thought. And then the second, to that initial discussion of what PT looks like now, and also what you're doing with Logan, I noticed this in school and in my neuro rotations, that when done right, neuro rehab is super challenging and intense. And you were talking about, the high intensity gait training, and there's maybe the assumption that you have to be extra cautious or kind of limit these patients that have some pretty large impairments. But I've noticed almost the exact opposite. And a lot of times they're being pushed more aggressively and more intensely than some things on the orthopedic side, where people are getting super babied.
Mm-hmm.
So I'm curious maybe to hear your reflections and your thoughts on how Logan's rehab has looked within the PT side, and maybe what you didn't expect, or maybe what you did, but also with yourself working with him, of maybe being a little bit more aggressive, I don't know if that's the right word, but with his, strength training and progress as a whole.
Yeah, he's definitely able to do way more than people would think, right? Like, we do not have to baby him. We don't have to be like overly cautious. I think that he also doesn't appreciate that when you try to like put the training wheels on. Like he's like, I can do this as long as I'm like, okay, I just want to make sure that I'm standing nearby. So I don't need to be like, he hated the gate belt, as most people do, right? So he like, as soon as we could take that off too, I'm like, okay, I'm just gonna guard you and just like, be here just in case you need me. Same with these when he's squatting, just like I'm a spot, but I'm not doing it for you, and I'm not gonna like have my hands on you. That's gonna cause you to become off balance. And he knew that about himself right away, because like the more hands on him and the more things that try to facilitate or guard him, he hated the exoskeleton. He hated when they had the bands on his leg that would like try to like bend his knee to get him to walk in a certain gait pattern. He hated that stuff. So he's like less about those cues and more about, let me just do it and figure it out, and then like reassess, reorient, and then just like do it different the next time. So like he's like learning, as he's going along. So I think it's kind of funny that you mentioned about the neuro versus the ortho side of things. In this specific clinic that he goes to, they have ortho on one side and neuro on the other. Okay. So I like look around and I made a comment to his neurotherapist like 3 weeks ago. And I was like, I think it's kind of funny, but I've never once seen the orthotherapist do anything besides be on the table with the patients. And, I was like, and you guys are always getting your people up and moving and you're challenging them appropriately. And you can tell that they are appropriately challenged. And he was just like laughed about it. And he was like, oh, that person over there has a weight in their hand. And I was like, okay, yeah, but they're still sitting on the table. Like they're not up and moving and doing things that like not the type of therapy that I do, right? So we are very, very much like a let's push people to like the point that we need to get them better. And the neurotherapists have that same mindset. And it's just in a um different sort of light because they have a different sort of focus. And so they are constantly still pushing him with his high intensity training. Like they want to get his heart rate up to certain zones because that's been shown to be really effective for people that have had strokes. And so he has like the heart rate monitor on him. And so they're like making sure that his heart rate's getting up to this like zone. And it looks like it's like zone 3, 4. And sometimes they're trying to get him to zone 5, but he just doesn't have the capacity to do that yet. And so they'll do it with the elliptical, they'll do it with walking, they'll do it with any sort of activities. They're pushing him. He has to get towels and like wipe off his sweat because he is being pushed. And I think that that is phenomenal because that's also like how he likes to train too. Like we like to push ourselves and being like a former powerlifter, like when I say he was a strong powerlifter, he could squat 650 raw and he could deadlift 725. Like he's a strong person. He pushes himself like to that point and he's just a hard worker. He's always going to be the hardest worker in the room. So he gets to be that person when he has the right people supporting him too. And so his neurotherapist, he has two. He has Chris and Kyle. So there's two that kind of go hand in hand depending on their schedules. And both of them, they will be pushing him to the point of exhaustion. And so he has to sit down and rest and okay, it's time to do it again. And it's almost like so nice to see them think outside the box too, because that's all what neuro rehab is. And that's kind of how I think too. So I'm almost like, man, did I miss my calling? But I think that I do neuro stuff in like what I do as well. But it's really cool to be like, okay, this is what you're missing. How do we make that happen? And so they'll like, they'll use different things that like cause more perturbations without even being on that specific treadmill with the water that slushes through like the different tubes and like the all these other sort of things. It's really nice to see. It's just refreshing, because you can just tell one, it's meaningful to Logan that someone is having to like think outside the box to make it more meaningful to him and what he wants to accomplish. And then it's also nice from like the caregiver too side of things to be like, okay, you value my husband and what he really wants to get back to, and I see that you're doing things to help him get closer to those goals.
What if, or the things that you've already adjusted, you've discussed just with the nature of what your week looks like with, navigating all the scheduling and rehab and the house, like literal tearing down doors for a while. But moving forward, and this can go really any direction you want, what do you continue to plan to adjust or modify in your life? Maybe that was different pre-Logan event that, maybe you didn't consider, or that just now you think will be kind of different, in the next few years or decades?
Yeah, I think that I don't know. I've always been the type of person that like I've always pursued things that make me happy sort of thing. But Logan's always been the type that like he didn't go to Paris with me for the last Olympics because I was there as treating a patient there. And so he regretted that. That was one of the first things that he said when he woke up from his coma. It was like, I wish I went to Paris with you. And so from that perspective, I can tell you that he's not going to say no to things that he really wants to do because time is short. Like we have no idea. There's nothing is ever promised, and tomorrow could not happen. You have no idea what's in store for us. So I think that he's already mentioned and he was like, next time you go to Australia for that conference, I'm going with you. And I'm like, he was invited this last time, like so it was just like all these things that like we're not going to put off our lives because of this. We're actually going to make them better, right? We're going to do everything that we want to do because we just don't know what tomorrow is going to bring.
Yeah, that's awesome. For individuals that are currently going through somewhat of a similar context, or people down the road that may have to face these challenges with themselves, a family member, a loved one, what reflections or thoughts or recommendations do you have for these people that are going through it as well?
Yeah, I think that making sure that you have someone in your life that can be your advocate or your like your healthcare guidance person. I don't know if there's someone out there that exists for people, but I just feel like without, us, Logan actually used to be a nurse. Fun fact. So he used to do hyperbaric medicine at Duke. That's where we met. So he already has that knowledge. I have the knowledge. So we are like already, we're in those fields. His mom owns a healthcare company. Like we are in healthcare as a family, and we still had so many struggles and problems and things that we had to overcome and fight for. So if you don't know these things, like I just feel so bad for people, and I feel like there has to be somebody out there to be an advocate and to be a resource to help guide them. So reaching out to people that maybe have been, in your shoes, that have gone through this before. I get messages all the time and I answer as many as I can. There's just always so many because I had no idea how many people are dealing with this on a daily basis. And I feel like right now there's something weird going on in the world. This last week, Chris's boss's wife had a stroke, and also one of my coworkers, her dad had a stroke. So I'm like, I don't know what's going on, but there's so many more people than we ever realized that are having these strokes and these problems. And if you can just find someone that's been in your shoes and kind of has navigated this, that can help guide you a little bit better, or even like answer one question, I think that that's invaluable.
Yeah, I agree. And it is tough. And it is challenging with, even if you have this person to help you through it, having the resources of other family to help you through it, the hospital systems, the time, it's just, it is a really uphill battle. And
Mhm.
that's, hard to avoid. But I want to respect your time. So I think the last thing I want to know or hear is, if people want to support you and your family in any way that they can, is there anywhere that people can go to help you?
Yeah, we still have our GoFundMe up, and I always feel bad asking for donations, but even just this week we bought the BioNest. Do you remember the BioNest for the foot, the electrodes that help to get your foot to lift up every time that you're walking? So Logan still has foot drop on his left side, so we just bought this device. It was $7,000. It's like there's still a lot of financial problems with all of the bills still coming in. So we have a GoFundMe page, but you can find all of that through my Instagram if you're curious. But seriously, no problems at all. I want to make sure that it doesn't put anyone else in a bad position. And I want to just, even if you just send words of encouragement, some days Logan has bad days, and even just words of encouragement are very helpful.
Any final thoughts before we wrap it up? I thought this was great, and I really appreciate you just being open and vulnerable to sharing your family and Logan's story. But anything before we finally call it?
No, I think that there's so much. We could maybe do a part two like later, but there's just so much. We're still in the midst of it, right? We're only 7 months in, and I know that there's neuroplasticity happens forever. Like it never just ends. So I think that right now we are just trying to maximize the first year. Everyone says that first year is so important, so we're just throwing everything we can at this for a year. We're making sure that we are doing everything we need to, and yeah, I have no idea what the next 5 months is going to bring, but I'm excited to continue to share my story on all my platforms. I share on Instagram, Facebook, TikTok, even YouTube. I'm doing a little bit longer form content on there, kind of showing a little bit more about the behind the scenes of what we're doing. So if anyone wants to check out any of that stuff, then we would love to have you.
Perfect. Yeah, we'll put all of the different places people can watch and follow and learn and see the progression, continued progression of Logan. So yeah, this was awesome, Stacie. We'd love to have you on for part two. And a year, 2 years, what have things continued to progress? But yeah, we appreciate your time. Thanks again.
Of course, Chris, it was so nice to have a conversation.